Hello out there in television land. Philip Benyo with It's Your Health with my bride, Mrs. B, and of course, our mascot, Virginia Jane. It's been a while. Welcome back to It's Your Health. We'll be back after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. Be right back. Is that right?
I wasn't listening.
What else is new? Been a while. I guess it's the summer since we had our last show. A lot has happened then. The summer's gone and went, and we're through football season already, so happy holidays out there. I left you speechless?
Yeah, you surely did. So how about if we just hop right into these?
I like that idea of hopping right into the headlines.
Okay.
Okay.
Did you pick these headlines?
Did I? I don't know.
Older women say they want more sex, not less.
Oh, wait a minute. Can you repeat that again, please?
You're being redundant. You can't say repeat that again.
Oh, okay.
You could say, would you repeat that? Older women say they want more sex, not less.
As far as I'm concerned, the show, I mean, this is it. That's all we have to say. See you later. Thanks, Sammy. Remember, it's Your Health, your leader. We'll be right back. What else do we have to say?
He wishes.
Okay.
Many women continue to be sexually active after menopause, and most say they are satisfied with their sex lives. 57% they wanted to have more sex. Only 8% said that it didn't matter to them. People used to think that women stopped having interest in sex after menopause, but we know that's not true. But I do have a question for whoever did this study. What exactly do they mean by older women? Post-menopause, that could be a 50-year-old woman. Or do they mean 80-year-old women? How many year-old women do they mean? Let's do the next headline. Don't say a word.
I can't even comment.
Bacteria are hard to avoid in public bathrooms. Frequent hand washing will keep those nasty bugs at bay, right? Nope, not if you're using a public bathroom. Everything you touch is contaminated. Bathrooms in restaurants, resorts, hospitals, and even libraries are crawling with bugs that carry everything from diarrhea to wound infections, that cause boils to antibiotic-resistant infections and E. coli and urinary tract infections. And
It's dangerous out there. You end up being like Monk. Do you remember him on television?
Yeah, okay.
Frequent hand washing may not do it. Sometimes, if you've noticed going into supermarkets, they have a little spray now that you use on your hands. Not a bad idea. It's a little difficult. All I can say is just be careful.
Some of the supermarkets have a wet one that you can clean the thing with.
Right.
And the other recommendation is have a tissue in your pocket so that after you're all done washing and you're ready to reach for that door with a tissue.
Mm-hmm. Well, for most of the bugs and the calamities you mentioned, most of us are doing okay, though, right? You don't hear a lot of calamities out there, do you?
Well, but it was a headline.
Oh, okay.
Next one. Getting your teeth clean may help your heart. This is one of my favorite ones. Getting your teeth clean may give you more than a sparkling white smile. It may give you something to smile about. People who had their teeth professionally cleaned at least once every 2 years were much less likely to have a heart attack. Their risk of stroke dropped. And because inflammation is a common problem in gum disease, it's also common in heart disease.
Yeah, that says it all. You should really bring your dental health up to date, and it is associated with increased risks of heart attacks, strokes, bad things, weight loss. Usually if you have bad teeth, other bad things are going to follow along with you.
You ready?
Yeah, I'm waiting for you.
Okay, because you said that said it all, and then you went right on talking some more.
Oh.
So it couldn't have said it all if you had more that you had to say to say it
You
all.
know what? I never met a man with so many faults. Yeah, seriously.
All right.
Okay.
Tell us about the benefits, the newer benefits of yoga and stretching.
Yes, it's very interesting. We, of course, see a lot of chronic back pain. Weekend warriors, they end up pulling a muscle or making their arthritis cry a little bit more. And rather than necessarily give pills, you might consider yoga.
12 weeks.
Stretching exercises.
Helps you for 6 months.
That says it all.
Okay, next one.
Okay.
This is one that's in the news all the time, but I don't understand it really. The restless legs syndrome, a disorder of the part of the nervous system that affects the legs and causes an urge to move them.
Yeah, very, very common in patients. Restless leg syndrome.
Wait, I have a question.
Okay.
If it's very common in patients, how come we never heard of it before?
Well, you've never asked. It's out there, sweetheart, honest. I appreciate it.
There's lots of things I've never asked.
At night, your legs become restless. Usually we see it at night, although it can be during the day. And it is a disorder which you just can't put your feet down. They feel like happy feet, if you will. Sometimes it's medicine-induced. We see it sometimes in diabetics. And in many cases, there's no reason for it. But the good news is there's treatment for it. There's a variety of different medications that will treat the restless leg syndrome. So you don't have to sit out there and suffer.
And it's true, isn't it, that you're more apt to have it if a family member has it?
Yep, like a lot of things, it runs in families.
Aren't we lucky? This is interesting. Top tips to keep your skin soft and smooth all winter. Heaters and prolonged hot showers are the biggest culprits. Would you like to add anything to that?
No, you're probably more versed on lubricating.
Okay, well, you should use a lotion in the shower. That's moisturizing. Put a moisturizer on as soon as you get out of the shower before you get dry off. And ointment is better than a cream, and a cream is better than a lotion if you're looking for something that's really going to stick. And although they recommend a couple in this article, I am big on the oil of Olay. They have a new line out called Pro X, I think, and I think that, along with a prescription one called Glytone, you'll kill me for saying that, those are the ones I use. I think they really work. Do you? Do you think they work? Huh? Do you? Do you think they work? How do I look?
I'm not an expert on lubrication, but go ahead.
Okay, I'm done with that one. I'm finished with you.
It's all right.
This is your turn. Talk about psoriasis.
Well, that psoriatic plaque, we sometimes see it in the winter months because you don't get the sun exposure, which tends to keep it down a little bit. Get a load of this patient who has these thickened, red, scaly, itchy plaques, and look at the difference between one to the next after treatment with medication. So I really think if you're out there suffering, you're suffering needlessly because medications like Enbrel can really do a number on it.
Wow.
That's a big difference, isn't there?
Tremendous difference. This woman could almost wear a backless gown to the ball.
Yeah, or Dancing with the Stars.
Oh, yeah. Okay, the next one, Pup to It. And this is a very interesting article because Sam just told us that his mom just got a puppy. I love puppies. Anyway, are you ready to get a new pet? If you have lost a pet, finish your grieving before you get another one. You have to be ready for a new personality, and so do the other pets in the household. I think that's completely wrong.
Really?
And we'll be right back.
After this brief commercial message, you're watching It's Your Health, your leader in veterinary and healthcare medication.
Welcome back to the next part of It's Your Health, and we're going to start with additional headlines just as we did in the first section. And we're going to take our headlines very seriously and pay close. I cannot believe you picked this as a headline. If you were watching the show, you remember what the first headline was in the first section. Okay, here's the first headline of the second section. Lots of sex, key to happier retirement. Sound familiar?
Can you, wait a minute.
Wait,
Can you repeat that? I don't think they heard it out there in television land.
Lots of sex, key to happier retirement.
Well, that ends it for this segment of It's Your Health. We'll be right back after this brief commercial message. That says it
The
all.
more
What more do-
often older people have sex, the more likely they are to be happy with life and enjoy a good marriage.
Do I have to comment on this?
Preferably not.
Well, it's obvious, isn't it? That makes everything go round, doesn't it?
I can name a couple other things that...
Like what?
Never mind. I'm doing the next headline. No. This is a really interesting one because at our shop, Kathleen's Collectibles, we're using a theme of Candyland for Christmas, and we're getting black licorice.
Oh.
And now I'm having second thoughts. Abnormal heart rhythms, as well as high blood pressure, swelling, lethargy, and congestive heart failure all can happen from eating too much black licorice.
Licorice in general has a chemical compound in it called glyceric acid, which will raise the heart rate and blood pressure of most people. As a matter of fact, I've often seen patients who have new onset of hypertension, and when we ask them what's new in their life and we quiz them, particularly on licorice use, it's up there. If you get rid of your licorice, their blood pressure and pulse will come down. But black licorice particularly is bad, so I would be very, very leery of ingesting it.
I was curious when you said that you query them about what they've done in the past, because I can't imagine any patient who's sick saying to you, I had black licorice.
Well, you have to ask.
Well, that's what I understood then, because
Okay.
I don't think people would think that was important enough to say.
That's why we're doing it here.
I know.
Maybe we should go back to the first headline.
He wishes. This is a strange one. Vitamin E raises prostate cancer risk. Vitamin E supplements actually raise the risk of the malignancy in the general population of healthy men. Yo.
Yeah, it's you think you're doing yourself good and well because vitamin E was a big thing a couple of years ago. Everybody was on vitamin E for whatever reason.
Yeah, before Cialis became the magic pill, it was vitamin E.
Vitamin E. So it can increase the risk of particularly prostate cancer in this study. So I wouldn't take a vitamin E supplement if I were you.
It claims in this article from your medical journal that the reason is we take too high of a dose. That if we cut the dose, instead of 400 units to 22?
I wouldn't take any vitamin E.
Okay, no more vitamin E. That's out. Take it out of the alphabet, too. E. Out.
Okay. But speaking of vitamins, there are some good vitamins out there that you should be on, right?
Yeah.
You going to tell us about them, maybe?
I am. The first one is iron. A common manifestation of iron deficiency is hair loss.
Oh, is that right?
Yes. I mean, you've got to start eating nails or something.
I'm going to have to. But actually, guys shouldn't be on iron, by the way, as a disclaimer, because we have no way of getting rid of our iron, and it could be linked to some heart disease in men. Women who have blood loss every month and have babies are generally iron deficient, so you gals can get away with taking iron to a point.
Yeah, but it also, it explains you. It says they're tired, irritable, and pale.
Is that right?
Okay. The next one that we hear a lot about is vitamin D.
Right. Bone health, no doubt. It is an epidemic vitamin D deficiency when we measure it in the blood. I can't think of a normal level I saw right off the bat in someone who's not taking a supplement.
And vitamin D helps to stave off breast cancer and colon cancer. The next one is biotin. I don't exactly know that one.
Well, it's not a usual one. It's over the counter. It helps with kind of everything in your body. It's sometimes related to the B family. So biotin over the counter just lubricates everything.
And then, of course, zinc, which is essential for your immune function, for vision, for taste, for appetite, fertility, skin, hair, nails, regeneration of skin, helps to heal cuts, scrapes, wounds. We found the new magic pill.
Yes.
It must be zinc.
It is zinc. Zinc is good, yeah.
Selenium.
Yeah, selenium is one of those trace elements that are required for metabolism. I'd probably look at it in getting more fruits and veggies kind of thing, although you can take a supplement. If you are going to take one, I would add that one.
Okay. Brazil nuts, tuna, beef, and vegetables.
Sounds like a plan.
Sounds like a good dinner.
Along with the nails. Well, it sounds like we've again proved the fact that this is the fastest half hour in television history. So we're going to be right back after this brief commercial.
And you better have a good headline for the next section.
It'll be handpicked. Remember, you're watching It's Your Health, your leader in healthcare information. Welcome back to the third and final segment. I hope our listening audience isn't zoned out as much as Virginia Jane is. Virginia Jane can be seen, by the way, live at Kathleen's Collectibles, which is very close to my office in Drums. It's on what, Butler Valley Drive?
Butler Drive.
Butler Drive,
yes.
Okay, right across the street from, there's a church right across the street.
And
right?
a cemetery.
And a cemetery, so she's in good company.
And Virginia Jane is very talented. She also writes a monthly column.
I read that, yes.
Okay. You better.
Okay.
Okay. We're starting. Oh, this is a good headline. Smile. This is a good headline.
Okay, I'm smiling.
No, you're not. Smile. There you go. Okay. Smiling makes you look younger. Go ahead and smile. It may be Mother Nature's way of giving you a youthful appearance. You know why? Because when you don't smile, all the wrinkles are there. When you smile, all the wrinkles are still there, but people think it's because you're smiling. Go figure.
Huh. Well, it takes more muscles to frown than to smile, and smiling is good.
Yes, it is. Smiling is very good. FDA approves Cialis to treat enlarged prostate. Cialis is the first ED drug to be approved for treating benign prostatic hyperplasia. And I won't go into what the symptoms are because you can tell them what the symptoms are.
Right. Well, after age 50-ish, your prostate enlarges, you men out there, and you may have difficulty voiding.
I figured it was for the men.
Or starting urine. You may be up in the middle of the night going potty. And, of course, most enlargements of the prostate are benign, but you should get digitally checked and maybe get a PSA to prove it, nevertheless. But Cialis, it's kind of interesting. Here it is, an erectionogenic medication being given to shrink your prostate.
Did you just make that word up, erectionogenic?
Yes.
Wow.
Well, that's, of course, going to be one of the side effects.
You're sort of like George Bush, huh?
One of the side effects of the medication, of course, is an erection.
But there are some people who shouldn't take it, like if you take nitroglycerin.
Yes. Well, you would have the same restrictions as if you came in for erectile dysfunction. And that would be, you should be watching it if you're on blood pressure medications, if you have heart disease, or if you are on nitrates, you can't take these things. What's wrong?
This time he hid it from me. Instead of making it the first headline, he made it the last headline.
I hid what?
And they all look so innocent. Hot flashes linked to higher cholesterol. Several recent studies have linked hot flashes to an increased risk for heart disease and also suggest a link between hot flashes and high cholesterol. I have high cholesterol. I have hot flashes. I have night sweats.
And it's not too
unusual. He doesn't sound very, interested in that.
It's not too unusual because, let's face it, when you're premenopausal, you have the protective effect of estrogen and your lipid profiles. Once you go through menopause, you lose that estrogen protective effect.
Yes, but while you're going through menopause, you lose your mind.
And then, what did you say? Okay. So anyway, what we were talking about is that you then become like a guy, and that is to say the guys have high cholesterols and lipid profiles similar to you when you are postmenopausal. So it's not too unusual that you will have high cholesterols after menopause.
But why do they relate it to night sweats and hot flashes? Just because they're symptoms?
Yeah, probably.
Probably?
Yeah.
Is that another word? Probably. Okay. You have to say this word for me, speaking of words, because I can't pronounce it.
Gabapentin.
is supposed to reduce hot flashes.
Right. We use gabapentin quite a bit.
No, we don't. I never got it. I get hot flashes all the time.
Well, you never told me. I thought that was just kind of part of...
I think you just liked me taking my clothes off at
Yeah,
home.
I didn't say anything. But gabapentin is also called Neurontin. And we use it a lot for diabetic neuropathies, painful feet, sometimes restless leg syndrome. But nevertheless, it's been stated to be helpful for hot flashes, Neurontin. So I think that's kind of useful. Non-addictive medication, so few side effects. Sedation, the biggest, but...
Big news about Allegra.
Yes, well, it's kind of...
A double-edged sword. Two ways of looking at it. The good and the bad. And the ugly.
So, Allegra is now over the counter. And it used to be a prescription drug, great for allergies and the like. So now, to treat your allergic symptoms, you can get Allegra over the counter.
But you can't get it by prescription.
Well, no, if it's over the counter, sweetheart, that means you don't need a prescription.
And that also means that your insurance won't pay for it.
Probably, yes, you're right.
That's what I was talking about, the good and the bad, the big and the little, the whatever I was saying.
Oh, well then, that's correct.
Okay, thank you. He said I was correct. It says here that hemoglobin A1C, which you will have to tell me what that is, helps in the diagnosis and management of diabetes and prediabetes.
Right.
Sounds like chemistry.
The red blood cell, sugar goes into it and gets stuck in there. And the average life of a red blood cell is 3 months.
3 months.
So that when your sugar's high, more sugar gets stuck in the red cell, and we can do a blood test called the hemoglobin A1C, which looks at how much sugar is in your red cell, and it will then tell us how high your sugar has been day to day over a 3-month period of time. So it helps us to manage your diabetes, but it also tells us if you're pre-diabetic, if you will. And most pre-diabetics go on to diabetes. So you can get a hemoglobin A1C and see what your risk is. If not, you actually can get your diagnosis of diabetes through an A1C. That make sense?
Yes, it makes a lot of sense. The only question I have is why don't they make the names of these things easier?
Well, it describes what it is. It's the hemoglobin. It's actually
Okay. Let's change the subject to something more important.
Okay.
Have you made a New Year's resolution yet?
No, I haven't.
You don't have much time, you know.
Any suggestions?
Do you have, let me borrow your paper and pencil.
Okay, we have 30 minutes.
The suggestion is that you don't make a New Year's resolution.
Well, that's why I didn't, I guess. I'm ahead of the curve, but
Right.
Go ahead.
You do it in the summer when it's nice out, when you're calm, when things aren't crazy for the holidays. You think about what matters in your life, what you need, and you make your resolution then. And then when you break it, you can have a great New Year's Eve celebrating.
All right. I think that's a great idea.
Okay.
Okay. Are we done? Can I go home now?
Yes, you may. We are finished with this edition of It's Your Health, probably. There may be some erectionogenic information we have to give you later, but for now, that's it.
Well, then let's
Take
go
care.
home.
Merry Christmas. We love you all. Happy holidays.
Right. Thank you for watching It's Your Health and allowing us to inform and hopefully entertain you, right?
I hope.
Remember, you're watching It's Your Health. Hard to believe you're a leader in healthcare information, but we are. Enjoy the new year.